Hi guys. Okay, so a lot of moms have been asking and messaging me about proper latch position and proper nipple position when your baby's nursing. And because I said that I wouldn't feel comfortable showing you guys on my own body, because I think there are a lot of videos out there where women do, I thought the next best thing is to use a prop for you guys. So I'm going to attempt to do that today. And I have with me a balloon, and I'm going to see if I can show you guys, because this is a way that I learned. I had hired a lactation consultant with my firstborn, my son who's now 6, and this is how she showed me how to properly position my nipple in my baby's mouth. So hopefully this helps. Okay, so first step, I'm going to blow up this balloon. Tie it off. Guess what this is going to represent? Yep. So let's say that this is our boobie and this is the nipple. So you've heard, hopefully you know this, but if you don't, so you've got your nipple and then surrounding it is the areola, right? Which is, the areola is sort of like the darker pigmented skin surrounding the nipple. And when you become pregnant, this area darkens. So it actually, and as your breast size is increasing, it also stretches out and it feels like your areolas are getting bigger. So there it is. There's our boobie and there's our areola. Now let that dry a bit. And I'm going to show you what happens when you are attempting to latch your baby on. So I'm going to put some lipstick on. Don't have like a really dark red shade or anything to show you guys, but hopefully this will come up well enough. I layer it on thick here. Okay. Sloppy job, but whatever. Okay. So if I were to, I'm the baby, okay? This is my mommy. She's about to feed me. So if the mom if you sort of like just push your nipple into your baby's mouth, if you got your boob and you're just going to attempt to like push it into their mouth or just bring their head straight on, like head on, this is what you're going to get. So my mouth is going to be open. I'm the baby. This is the nipple coming into my mouth. Now if you can see, those are my lips. And I'm inside the areola. So I'm only getting the nipple right now. I'm not getting this part of the boob. I'm only getting the nipple as the baby. Okay? And I'm going to attempt to suck on this, but it's going to hurt you. It's going to hurt you, the mom. And it's not going to feel good. And the milk is not going to come out like this. You know, when they're like milking cows, they actually start from up here. They start from like the way up here, and they pull down. They gently like squeeze in and pull down. So the baby has to mimic this sort of the same technique. So if you just have the nipple straight into the mouth, hop out, the baby's not going to get anything except the nipple. So let's just wipe this off and wipe. Excuse the messy desk behind you, behind me. Alright, so I think that's cleaned off. I'm going to do it again. And I talked about this in one of my, what happened to my list? One of my previous videos, where what you want to do is do like the flipple nipple technique, I call it, or kind of like the roll in. So I'm going to show you what that will do and how that differs from just getting the nipple straight into the mouth. So again, I'm the baby. And here's my mommy. Here's my mommy's milk. Mommy's mums. And so when you're feeding your baby, you want to aim this nipple upwards. So there's the roof of my mouth, right? Right there. And the nipple, your nipple needs to be aiming up there. Okay? So picture it for yourself where, you know, we're in a laying down position. I can't really maneuver myself that way for you, but when you're in a laying down position and you've got your boob and you've got your baby's head, this nipple is going to be not straight on to the mouth. It's going to be tilted a bit this way because it's going to go to the roof of your baby's mouth, right? You want to aim it to the roof of your mouth. And then when you're holding your boob, you want to like pull a little bit on your, like on the outer edge of your areola. If you kind of go like this, then do you see what happens? This is really going to be aimed like up here to the nose of your baby, and when their mouth opens, like this is my finger here, this is their bottom lip. Their bottom lip is going to come here, and then their top lip is going to come just above your nipple. When they suck in, then they're going to get all of this, and their lip is going to extend up here, and now they've got all of the areola, and now the milk is coming. Now it's like, wow, it's a feast. So that's what you want, okay? So you want to hold your boob and you want to aim it this way so that it's pointing to the roof of their mouth all the way like pretty much to their nose. So their bottom lip is getting as much of the areola, and then when you roll it in, it's going to grab all of this. Okay, so I'm going to show you, because if it's pointing to the roof of my mouth and I open my mouth as the baby and I want the boob to come in, so the mom is going to kind of gently like point the nipple that way, like by pulling on your skin gently, just at the outside edge of the areola. So that nipple is going this way, and then the baby opens their mouth, okay? And then you as the mom are gonna flick it in, like roll it in at the right moment, and it's gonna take some practice to do this part, but you'll get it. And now let me show you the difference. There's my bottom lip, there's my top lip. Now I've got this whole section of boobage, and yummy, yummy stuff is going to come out. So that is the difference between a proper latch, and that's what you want to get. You want to get your baby to grab as much of the outer edge of the areola, as much of the areola in as possible, not just the nipple. A few things that if you're doing this, you need to reevaluate your position. Number one, don't chase your baby with your boob. Don't do that, okay? Number two, don't shove your boob into your baby's mouth. Your body needs to stay stable. You're in your proper, straight back, nicely seated position. You're comfortable, and your baby is going to come to you. Okay, you're going to bring your baby to your boob. You're going to hold your boob so it's nice and supported, and you have control over how you want to maneuver your nipple. But you're just going to have a nice control over it. Your thumb on the outside, maybe like 1 or 2 fingers on the inside, so that you can do your expression like this. So odd doing it on myself. So that you can do your expression like that when your baby is nursing. Okay? So, you can hold your baby's head like this, make sure they're nice and supported, and their body is like tucked. You can tuck them like way underneath your boob here. Make sure they're nice and snug next to your body, and so that their hands and legs aren't flailing everywhere, and they feel very secure, right? And same with like the side position here. You can bring them around, same thing. Just hold your boob here, bring their head around here. This is called the football position. So if you've got your nursing pillow, then it'll be a really nice hold. Okay, so I hope that makes sense. I hope it helps. Let me know. And like I said, if you ever have questions, please, please, please message me. I'll be happy to answer them. But this demonstration really helped me understand what was going on with my baby and with my body, and I hope it does the same for you. Okay, so take care, guys. Happy nursing. Bye.